So hi, Matt. I'm
Morning.
very happy to see you again, and it's become a habit to have these online meetings. You're based in the US, and I'm in
Mhm.
Sweden, Scandinavia, and we have a common interest in erythromelalgia. And you actually reached out to me some time ago, and maybe you can just tell whoever may watch this why you did so and how that came about.
Yeah, it's good to see you again and good to be here today. My name is Matt Sondag. I live in Boston. I'm 49 years old, and my journey with erythromelalgia, or as people refer to as EM, started about almost 4 years ago, where I just sort of started to feel pain in my feet, where doing, things that I would kind of normally do started to become more painful. So, and for example, I remember one day walking off the golf course and kind of really struggling and kind of feeling like, well, my feet are, starting to get really painful. And it was something that came on slowly for me. I think everyone probably differs a little bit in terms of how fast or slow it comes on, but for me, it kind of came on gradually, and then it started to probably it was probably 6 months after that before I started to pick up the phone and start making some appointments with some doctors, because that pain started to kind of continue to go up. Um, and it got to the point where, I was trying to maybe walk for, maybe it was 2 hours. Being on my feet, became a big struggle. And so my journey, I think, is similar to a lot of others, where I set up meetings with various doctors, and, starts with one. And I think that was, particularly, I would say, a lengthy process, and probably for anyone that has trying to figure out what's wrong could sympathize with, in terms of being very frustrating, because you go to doctors and feel like that they should have all the answers. And I think with something as rare as EM, it was a long process. I mean, I think I probably saw almost probably 40 to 50 doctors
Okay.
across all the top health systems. So at the
So
time, I
people are
was
not
living in
aware.
Chicago.
So doctors are not aware of this condition in the US.
No, they're really not. And I was at all the major hospital systems. So all the hospital systems in the top 25 in the United States. So Cleveland Clinic, Mayo Clinic, or I eventually went to Mayo after a diagnosis, because it's the only clinic in the entire United States that deals with this. And it's a 2-year wait to get in. So you can imagine, uh, also in terms of trying to get care. But I was living in Chicago at the time, and went to, Northwestern and University of Chicago, and North Shore, and Cleveland Clinic, and nobody could kind of figure out what's going on. And I even had a surgery procedure in my left foot, because they thought it was something else, and obviously that didn't help it. But it was probably a 2-year journey of speaking with different doctors and doing various research on my own to kind of figure out what was wrong. And
Mm.
just happened to find a doctor that had seen it before, and he was a vascular doctor, as this disease has a vascular component to it. And he said, "Hey, I think you've got this thing called erythromelalgia." And so that was about 2 years in. And at that point, from a pain level perspective, being on my feet for 20 minutes was extremely painful. So you can imagine
So on a
the
scale from
impact.
1 to 10, how what is extremely painful for you? Because I think that can
I
vary.
mean, yeah, I mean, it's a 9 or a 10 after 20 minutes, where you literally cannot stand anymore.
Yeah.
And
And the
and
sensation you
so
have, what is it like? I mean, painful, it can be different kinds of pain. So what is the pain you experience?
yeah, so your feet get red and swollen. And then you've got pain along the entire bottom of your foot. Some people get it in their hands, some people get it in their face. I've been lucky enough to not get any sensation in my hands or face. So it's just in the feet. And at that point, like I said, at the time of that diagnosis, it was probably, 30 minutes where, the pain was extremely, painful. And the challenge with it is, there's just not a lot out there in terms of trying to help with this disease.
Well, so
And
what do you
so,
do to cope with that? I mean, you're working and you travel, you tell me, and
yeah,
overseas also. So how do you deal with that
yeah. So I
extra
think, I mean,
extra facet in your life, I would say.
yeah, yeah. Well, there's two things. Number one, I think that I'm pretty fortunate from the perspective of having a job that doesn't require to be on my feet. And you think about all the folks that have EM that have a job that require them to be on their feet. And I've talked to several of them, they have to quit their job. And I think that's one of the big reasons, in addition to just the overall impact on the quality of life, why the suicide rate for EM is so high, is 25%.
Yeah, you told me that. Maybe we can get back to that, but just so just dealing with the disease. So you can deal with it by not being on your feet so much, but not all can do that. But you're lucky enough to be in that position, so that's great. But what otherwise? I mean, do you have to like sit or lie, and can you walk, or can't you walk, and what, how do you get your life going? Buying groceries and go out to the garbage and all that that every normal life also contains.
Yeah, yeah. Well, I think at the peak of my pain, it was, I would get up in the morning and I could barely get through shaving in the morning, where the pain was just too hard, where I had to sit down. And fortunately, it's gotten a little bit better, and I'm able to stand for 20 to 30 minutes now. But at the end of the day, you have to plan around making sure that you're not on your feet for that long, and so and also keeping warmer temperatures causes the feet to flare. So
Yeah.
while most people enjoy the summers, I enjoy the winters and the spring and the fall when the weather's cooler, to keep my feet.
So you found out that there are some triggers for you, and I think that's maybe not common knowledge, but we have at least read that there are some indications that there might be triggers like red wine or spicy food or warmth, maybe also. So maybe you can. What did you figure out was, causing? Because I never, well, I met you now, but otherwise I'm not familiar with the disease. So I read that you get some kind of flares where you have these intense periods of swelling and redness and pain, or is it more a constant thing, or is it flares? And if it's flares, what can trigger them?
Yeah, the pain. So it's interesting. The pain typically is more constant, or I should say, it's a little bit better in the morning, typically, and then it gets kind of worse throughout the day, and then in the evening, when your body you got your sympathetic and parasympathetic nervous system, when you start to go to bed and your parasympathetic nervous system kicks in, that's when you tend to flare more. So nights tend to be the worst, where your feet get really red, and so yeah. So I from a and also, to your point, foods can cause certain things to your feet to flare. So I have adopted so trying to do things that drives down overall inflammation in my body. So at the end of the day, my feet are becoming inflamed. And so I've tried to adopt eating foods that are low inflammation foods. I've tried to eliminate things like seed oils from my diet that can cause inflammation. And also like remove gluten from my diet as well, just to give me any benefit from an inflammation perspective in my body, to keep inflammation down. And then do certain things in terms of, as I mentioned, keeping things cool. Where I am, I know I've read a lot of folks will put, I know for a period there, I was having a fan on at the end of my bed to kind of keep my feet cool, and doing things like that and keeping them from flaring.
We also, but we are working on the chili receptor, the popularly called chili receptor. So chili can also, so active ingredient capsaicin can. Did you experience any effect of that, either positive or negative? So eating spicy food.
Yeah, I did. And so eating spicy foods. So a couple things. One, eating spicy foods that tend to be high in oxalates. So removing seed oils and removing oxalates helped me to keep inflammation down. So I've changed my diet pretty drastically.
Okay. And what about ice baths? We read about the patients want to put their feet in ice baths just to keep them cool, but it has some other problems also with, the
So I was one of those
problem.
Yeah. I was early days. I was putting my feet in buckets of ice just to kind of cool them off, and it gave me instant relief, right? But then I've also read that that's not good to do, to really subject them to such cold temperatures. So I don't do it anymore, but have read that a lot of folks kind of do that.
Mm. So that's kind of, you try to come about it with lifestyle changes, right?
Mm.
And any kind of treatment options you were introduced to after you got your diagnosis? I mean, one thing is to find out what's wrong with me. I guess that's some kind of a relief, but then starts a phase of, okay, now I have to goddamn live with this new companion in my life. And were there any kind of, treatments recommended from the doctors?
Yeah, so there's different treatments. I visited the Mayo Clinic, and they had prescribed a cream to help with the pain and gave very moderate relief for me. I think for other folks, they experienced maybe some better relief, better success. But and then I've just tried various things over the counter to reduce the kind of sensation in my feet and reduce the pain level. The challenge with them is they tend to maybe give you some very, very short-term relief. And they really don't help keep your feet from flaring. So it might reduce overall pain, but it doesn't keep it from flaring. And a lot of them also tend to have various chemicals and things like that and also, who knows, cause additional flare and things like that.
Could be.
So I've tried lots of different creams and CBD and everything kind of under the sun to try to reduce pain.
And no success or moderate success? So.
Yeah, I would say for the most part, no success. I mean, I'm not doing anything now. I've tried lots of different things, but nothing really stuck.
But then you heard about us. Somehow you read about us, and then you wrote me, and then we started. So anything particular in our project that you got interested in, or is it more this? I mean, what made you react to hearing about Pila Pharma in Sweden?
Yeah, I think I have a Google alert set for erythromelalgia and read the article and just wanted to reach out and at the end of the day figure out how I can help. Because I know it's a horrible disease, and it really impacts an individual's lifestyle. If you think about, it'd be one thing if you just said you can't run. It'd be one thing if you said you just couldn't walk for long distances, but even things like standing, right? So think about like trying to cook a meal. And if you were to stand in the kitchen for 20 or 30 minutes to cook a meal, that's really hard. And so you've got to kind of plan your day around staying off your feet for long intervals. So I think I mentioned to you kind of traveling and going through airports and things like that can sometimes be a challenge, right? I was walking through Heathrow a couple months ago where I think it was about a 1.5 mile walk. And it's just something that I couldn't do. I had to kind of sit down 2 or 3 times to get through. So you just learn to adapt to staying off your feet and keeping them cool.
So if I'm just trying to maybe sum up a little bit. So what I hear you say is that you still have a more or less normal functioning life, but you're really affected by this, and it's primarily pain. Are there other symptoms that are like irritating besides, of course, maybe cosmetically it's not so nice with red feet, but I guess you can you wear shoes? Can you things like that? But is it primarily the pain issue that needs to be tackled to come about this condition, do you think?
Yeah, it's the pain level that gets pretty excruciating, and then the impact on your lifestyle, because if you can imagine the lifestyle change that comes from that, and everything from potentially the impact on your job if you have to quit your job, and the impact on being a caregiver for somebody else or whatever it might be, right? So it just has a major impact on everything that you're doing. And little things like I haven't worn socks in 4 years, just because I really don't want anything touching my feet, right? So keeping them as cool as possible. Now that's the least of my concerns of not wearing socks, but things like cold showers, like I don't take warm showers. Again, those are small sacrifices in the grand scheme of living with this, based on some of the other stuff I mentioned. But I would say it's not one big lifestyle change. It's 100 little things from everything.
But it goes down to the same root kind of symptom of pain, right? The pain affects so many other things. So if we could tackle the pain, and that is, I guess, the principle behind our potential new treatment, that we can block this heat pain sensitive channel, GRPV1 or the chili receptor. So if we could put a lid on that, we could maybe take off the top of the pain. We couldn't cure the disease, but take off the top of the pain, and maybe also the sensitization, maybe the detection of pain could also be changed, so you don't react so fast on things. Would that be anything? I mean, and do you think you would need a treatment every day, or only when you have flares? And
who knows? I mean, even if I've always said, like, if there was some sort of treatment that gave me 40 or 50% relief, like that would be a huge game changer. Absolutely. Because the amount of extended time that I could be on my feet would be huge. And, you can also think of the other implications of just not being very mobile and on your feet all the time, in terms of the impact on your health, right? I went from, skiing and playing hockey and mountain biking and hiking and all that, playing golf, all that kind of stuff, to, I'm able to kind of get up and get on a stationary bike in the morning to kind of get a little bit of a sweat in. And then I also took up swimming. But you can imagine that the overall health impact of being so sedentary. So there's also that, right?
Absolutely. So I hope we can help you. But yes. So thanks a lot for sharing your story here, and I hope we can really do something to help you and other of your fellow patients with erythromelalgia.
Thank you. I applaud what you guys are doing, and any way I can support, I'm here. So I appreciate all the work that you guys are doing.
Thanks a lot.